Hello, good morning. I'm audible. Thank you.
Good morning, sir. We are very happy to have you with us today. So I think we can get started with the session.
Yeah, hello, good morning, all.
Yeah, hello, sir.
So, shall we start or we can wait?
Yeah, sure, sir, sure, sir.
So, I think
Good morning, everyone. It is my great pleasure to welcome you all to this webinar on the topic Healthcare Analytics. I hope it is a platform for us to exchange ideas, foster collaborations, and inspire innovation. It is now my honor to introduce our distinguished guest speaker, Mr. Manigandan Sinichami, Senior Engineer, BI Architect at Rolls-Royce Solutions, Asia, Pune, Maharashtra, who is one of our esteemed alumni, batch 2003. He has 20 plus years of experience in the field of engineering. His journey has been marked by steadfast commitment to excellence and innovation, particularly at Rolls-Royce Solutions Asia. His core competencies include advanced BI architect, digital solutions, development, and driving operational efficiencies. He has trained over 180 colleagues in BI and deploying digital solutions like MTU Go platform. He has also played a pivotal role in advancing digital capabilities, showcasing the power of data harmonization and analytics in driving business outcomes. Without further ado, I now invite our guest speaker, Mr. Manikandan Sinishami, to take over the session.
Okay, thank you. And I'm sorry, in between, suddenly some network issue. Yeah, I'm very, very happy to see you all, and very happy to give you a small kind of seminar to all the students. Okay, let me start. Okay, before going to start, I introduce myself. My name is Manikandan. I born and brought up in a small village called Tevaram, which is Theni district. Then after I completed my diploma in mechanical engineering in Nagarkoil. Then I got opportunity to study in National Engineering College. I have completed my mechanical engineering in 2003. Then later I joined as a production in charge in Osur. I have worked almost 2 years. Then after some of my friends suggested me go for a design. Then I did my post diploma in CAD and CAM in Orissa. Parallelly, I was worked as a CAD engineer in Central Tool Room and Training Center. Then I moved to different places, which definitely it will take time. Okay, so then 2011 I got opportunity to work for Rolls Royce. uh, then God's wish, I'm continuing this same company almost last 13 years. This is my 14th year. My office earlier it was in Mumbai. Then after it, we are we are moved into Pune. So last 8 years I am working in Pune. So I'm a senior engineer in my organization. Parallelly, I started working in data analytics since last 5 years. I'm also working in data analytics. I'm creating business dashboards, reports, and a very passionate trainer. I also trained more than 200 employees in my organization, and I'm also mentoring for many students in Pune. I also got opportunity to mentoring for some three students for National Engineering College, and I'm looking forward to get more students in this upcoming year. Then about my personal life, I got married. I have two children, two boys, and both are going to school. And my wife is a Zumba instructor, and she have her own business. Then I'm also a passionate marathon runner since 2013. I have completed 19 full marathon and 21 off marathon, including six international marathon. I love singing. So I also completed almost 5,000 songs in Smule app. So singing helps me to remove the stress. Okay. Then on free time I watch movies. I'm a cricket lover, so I also watch cricket. This all are all about me. Okay. So without further delay, we can jump into our seminar today. Okay, I will share my screen. Could you please confirm you can able to see the screen, right? Thank you. Okay, we'll start. So this is the definition about healthcare analytics. Okay, so healthcare analytics means to analyze the data systematically to develop the healthcare and improve the decision making. So generally data analytics it helps to for the any organization for decision making, so you may be aware of it. So for this analytics, statistics and data visualization machine learning tools are mostly used, and healthcare data are helped for actionable insights. So now we can see some of the key aspects in the healthcare analytics. So the first one is improved patient care. So generally, this improved in patient care, identifying the treatment of and understanding the trend and personalizing care and predicting the disease and monitoring the patient health. So this is called improved patient's care. So then operational efficiency. So operational efficiency means to streamlining the hospital workflows and resource allocation and cost reduction. So this is called operational efficiency. Then predictive analysis. So predictive analysis is very important for any hospital. You know, if suppose, for example, there is big hospitals like Meenakshi Mission, Apollo. So they and all they have to know how many patients are coming, how many patients are going, and whether they are for readmission or they are coming for something else. They have to know, right? So that's what this predictive analysis will helps. Okay, using data to anticipate the disease outbreaks and patient readmission or equipment failure. So these all are, it will come under predictive analysis. Then clinical research. So clinical research means generally enhancing the drug development and the clinical trials and evidence-based mission. Okay, so this is under clinical research. Then population health management. So addressing the public health concerns by analyzing the trends across demographics. So generally trends means a particular period, what is happening over the period. Okay, last 5 year, like last 10 year, or maybe last 6 month. So based on this population health management, so the hospital or maybe the health industry, so they will understand what is happening in and around. Okay, so these all are some key aspects of healthcare analytics. So now some of the common tools and technologies which used in healthcare analytics. So one is electronic health records. So earlier, you may aware of it, all the health records they maintained in the notebook or ledger or something else. So even maybe sometime now also some small hospitals they are maintaining their health records by a big notebook or maybe some kind of big ledger, uh, kind of big notebooks. Okay, you may aware of it, but it won't helps if they want to understand further what is the incoming patient or outgoing patient, or you know what is overall the hospital performance, how many doctors are coming, how many staffs are working. So this kind of thing, maintaining the notebook, it won't help. So that's what nowadays electronic health records, monitoring system and all the system, it is coming into digital. You may very well aware of it. Then after artificial intelligence and machine learning, yeah, so this is also changing a big a kind of revaluation in the world. It helps you a lot for all the industry. Then big data platforms. Okay, suppose if the hospital is the network hospital, so Apollo hospital, it is available in all over world. Okay, so many hospital, it's like a chain business. So they have to maintain lot of data. So each and every hospital have more than a lakh of data. So how they are interconnecting each and every data? So they need the platform like SQL or maybe any other a server like AWS. So many servers are nowadays in the market. So everyone needs to maintain their big data in the particular platforms. Then business intelligence tools like Power BI, Tableau, so lot of Quicker. So lot of tools are there. So these tools helps to analyze, and based on that analysis, they can organization they can take a decisions, right? So that is uh, so this business intelligence tools helps you a lot to analyze. Then programming. So nowadays lot of programming like a popular program called Python, or so this programming also you can integrate with the business intelligence tool. Maybe you can check in the Google how it is integrated. So earlier by using the Python or and all you can write simply programming, but nowadays you can write the program inside the business intelligence tool and you can do more analysis, and you can this that particular report, it will perform very well, and it is very accurate. And also some complex data also you can easily take care and control by programs. So these all are the common tools and technologies. Do you have any doubt? Is it okay? Going good? So I want to explain bit in Tamil, or English is fine. Okay, okay, no problem. Maybe after the presentation maybe we can discuss little more. Okay, don't worry about it. So next, so some of the applications in the health sector, you can see predicting patient outcomes based on historical data. So the historical data is very powerful. Okay, so every organization they have a historical data. If the organization started 10 years before, they have a historical data. Okay, by using the historical data also they can understand so many things. For example, so in the healthcare analytics, so patient outcomes will be predicted like using the historical data. And machine learning models, it will help to structured data into unstructured data. So these all are coming in ETL, extract, transform, and loading, which is used in the analyzing tool. So machine learning models, it will helps to change the unstructured data into structured data like EHR, lab results. Okay, so these all are a typical data which is coming from the health industry. So sometimes it might be unstructured. Okay, unstructured means lot of unwanted data. Okay, so when they want to do some analysis, so unwanted data should be cleaned. Okay, so for that the machine learning will be used. So then predictive analysis, it help to disease progression and readmission rates and treatment effectiveness. Such a metrics will be measured by the predictive analysis. Then data cleaning and future engineering and model validation. These all are the process of analysis. Okay, so these all are you know helped for personalized care and better resource allocation for the predicting patient outcomes based on the historical data. So then detecting fraud and improving claims management in health insurance. I can share you some experience. We all are working in the corporate world. So every company they are giving the medical claim policies. So earlier what they do, some people just to claim for that medical treatment amount, sometime instead of 3,000 rupees, they will take a bill for 5,000 rupees. It's a very common thing. Earlier days, it's a very common thing. Okay, so they will request to the you know, like medical shops, can you please give me for 5,000 rupees bill? And so it's very difficult to ask to the doctor, but it is very simple to ask the, you know, kind of medical store. So they simply ask, even though sometimes people without thinking, they will ask, and some medical shops also they will give. Just 1 minute. Hello. I'm really sorry. Really sorry. I'm audible. Okay. Really sorry. Some, I don't know, some network issue. Okay. So, yeah. So now we are talking about the challenges. Okay. So these all are some of the challenges for the day-to-day life. This particular healthcare analytics industry, they are facing day-to-day life. Okay. The first one is keeping patient data safe. So yeah, data safe data is nowadays it's a question mark, but still uh, the industries and the all over world they are fighting for this. You may aware of it. Okay, so for example, protecting patient information from the hackers and following strict privacy rules like HIPAA. So it is Health Insurance Profitability and Accountability Act. Okay, is a big challenge. Okay, so especially for growing country like India, it's a big challenge. So that's what we need, the very strict act law needed to save the data. Then data in different systems. Sometimes what happened, the data are different places. Yes, of course, one hospital have different department they are telling OPD, outpatient, inpatient. So then patients, though those who are coming for surgery, then some patients are coming, regularly coming for the monthly checkup, then health checkup in a year, and the different diagnostics and labs and so many things. So everywhere the data is playing the vital role to maintain the records. So that's what we, the data analytics people, they are introducing a concept called single source of data. Always the single source of data, it is very good for analytics. Okay, suppose if it is the chain business, like the hospital is in different cities, or maybe the business is any business, if it is running in the different countries or maybe a different region, so all the data should be connected together, and it is called data modeling. Okay, so this particular data modeling, it helps to maintain the single source of data. Then it will be very easy to analyze. So at last, what we want to know the performance of this health industry. Based on the performance, they can take the decisions, and uh, then it will be beneficial for not only the industry, it will beneficial for the people also. So that's what single source of data is very 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 important. And also data are in different systems, they have to maintain very appropriately. So the digitalized data maintaining, it will be the uh, a good option for any industry. Then incorrect or missing data. So sometime what happened, generally the public uh, service kind of work is very hectic, aware of it. So some people, they are working in the counters, so they always, they will be getting angry and they don't speak very nicely. But even though if you are speaking very soft, they will speak little loudly, or sometimes they don't answer properly. So we will get sometime some kind of irritations, well. Okay, so due to this kind of situations, there is a possibility of wrongly entering the data. And we all know sometimes Aadhaar card have spelling mistake, PAN card have our name is missing, or maybe they added some additional letters. So it happens everywhere, right? So this kind of things also the big challenge in this particular industry. Then people hesitate to use the new tools, so that is the another headache. So if the person in this particular industry, or maybe any hospital, or maybe any other industry, if they are maintaining so many years, they are maintaining the notebook and they are writing habits. And another big challenge is some people, if they are less educated, they always write in their own mother tongue, right? So that time also it will be the very big challenge. And if you are introducing a person who is studied in the 10th standard, you are we are telling to, no, you have to maintain the system and you have to type each and everything, the patient details or maybe any other data you have to enter, they not immediately accept, first of all, right? And for your information, I would like to share something. I want to share you something. I went to some 1 year back to one of the reputed hospital due to some health issue, and that particular hospital, all the doctors should write the patient history in the computer. Okay, so the doctor who studied MBBS and he is very good in English, everyone know very well, and that doctor is very much hesitated, or maybe he is very, kind of laziness to write the patient history in the computer. He already wrote in the notebook, but the same instruction, okay, he have to write in the computer, because the big hospitals, they always want to improve, and they want to well maintain the data, especially for how many patients are coming for readmission or maybe the revisit, and how to avoid the revisit. For example, the same disease I am going after some time, the doctor quickly can understand, oh, okay, this person have already have a problem. So of course this will help to, maybe he can change the medicines, or maybe he can continue the same medicines. So this will be the time, time saving things, actually time save and the cost saving. So many way it will be very helpful for the hospital as well as patient. But the problem is doctors, or maybe the person, they are not interested, for the new technology. It happens everywhere. So then, complex AI models. Sometimes what happen, advanced tools like AI are often too complicated to understand, right? So even though if the nowadays I'm seeing people are very much interested in data analytics, but when someone is telling coding is recorded, they are not interested. So even though even I'm seeing computer science people also, sometimes they are very very scared about coding, writing the coding. So but you have to do that. There is no any way. Okay, so that's what the AI models are sometimes too complicated. So when you are using the AI data models, okay, you have to think how we can make it simplify and make it understandable to each and everyone, and how to reuse the AI model in future. So always you have to think in such a way, and you have to prepare your complex AI models which will helpful for everyone. Okay, so these all are some challenges in this industry. So then here five simple ways for your AI and DS support to the healthcare analytics. It's quite interesting. And yeah, the first one, faster diagnosis. Oops, 1 minute. Okay. Okay, no problem. Okay, so before going to the this AIDS support for healthcare analytics, some of the advantages I would like to share, which is some points I have missed. Okay, so the healthcare analytics, it will help for in three different way. Like it will improve the patient care, and it will prevent the disease early, and it will save the money, and one more, it will be the better decision making. So in that way, this healthcare analytics will be very advantage for everyone. So then, five simple ways for this AI and DS support for the healthcare analytics. Okay, the first one is the faster diagnosis. So AI quickly analyze the medical images like X-rays and patient data, and it helping doctors to detect disease faster and more accurately. So that is the one of the big advantages yeah, in this particular healthcare analytics. If you are uh, coming come from the AI and the DS background, then predicting the health risks. Data science studies patient history to predict future health problems and enabling earlier treatments and prevention. So preventing means something we have to understand in earlier stage. You know, the cancer and all, it is very there is no very less medicines, or maybe the cost is very high to save the life, you know. So if you can hear about it, some patients, or maybe I can say some people, even in my friend circle, recently it happened, one of my friend, she got a cancer, but it is diagnosed very earliest stage. So because of that, he able to survive, but the treatment, it went almost 1.5 year. So it will be really tough time for them. But even though, because of the technologies, she saved in her life. So that's what the data science studies, it will help to the predict for future health problems. Then personalized treatments. Sometimes artificial intelligence, it suggests for the customized treatment plans based on a patient's unique medical history and needs. So that's what sometimes the patient's historical medical report, it should be very important. Even though sometimes they will tell what is there any genetic problem with the same disease it happened to your father and mother. So that and all they are checking. So that kind of thing, it will be noted down in the data suggest, you know, the for the better treatment. Then drug development. So drug development means that the data science speed up research by analyzing millions of data points to identify effective medicines. So nowadays, if you have someone in diabetic, you may ask them every 3 months or 4 months, they will go to the doctor. Doctor will be keep on changing the medicines. So it is not only for the beneficial of doctor or maybe that pharmacy companies. So they keep on do the research, and they will find out the better medicines, which will be in less cost. And you people, I think someone you can check, you know, compared to the regular medicines, generic medicines are very cheaper. Okay, but the people are, you know, not much aware of the generic medicines, and they are not much buying. But even though if you feel the regular medicine cost is very high, you can go for a generic medicines. So many pharmacy and medical stores, you will get the generic medicines. So then improving the patient care. So AI powered tools like chatbots and visual assistants, it will help to the patient with the reminders, queries, and monitoring their health from home. So nowadays, you know, because of due to age factor or maybe some other factors, it's not so easy to do, you know, follow up treatments, or maybe reminders for remembering everything. That will be quite challenging for the people. Okay, after the ages, maybe 45 plus, 50 plus and all, easily forget. Okay, so this kind of system, okay, it will be give the reminder, you have to this particular month, this many patients have to revisit the hospital, they have to again, they have to check, they have the follow up with the doctors. So this kind of thing nowadays AI will take care. So how it will take care? Based on the, whatever data they are maintained. For example, the person is visited last year December. Okay, so they have a 3 month of time, so again they have to revisit for March. So automatically this particular AI powered tools, it will be taking care, and it will give the pop-up message to the hospital, and or maybe the hospital, they maybe have a digitalized system they can use for trigger the automatic SMS to the patients. Okay, oh, you have it may be give the SMS to the patient, the next 3 days your follow-up uh, visit will be there, you have to visit the doctor. And this is not only help for the patient, it will the same message sometime it will trigger to doctors. Okay, so the doctor also will be, will be making their availability, and patients also, it will be, they will book their appointment, and they will be ready to visit the hospitals, right? So in this way, your AI and DS support for the healthcare analytics in such a ways. Okay, so this much only I have prepared for you because it's a very short time. And one more thing I would like to show you. Okay, I have created one small uh, Power BI report. Can you able to see? Okay, you can able to see, right, for this particular one. Could you please confirm? Can you able to see? Yeah, okay. See here. So this is the one small report. How, yeah, how the healthcare report could be generated. Okay, so this entire report I have generated by using the Chat GPT. Okay, so you can see this is the simple report. Okay, simple data sets. The first table, it have a hospital readmission data. You can see some of the patient ID, the patient age, okay, then gender, then what is their problems like heart failure, diabetics, and hypertension, kidney disease, and admission type, whether emergency or urgent or something else. So then length of stay, how many days they have to stay, then discharge status. So some data are there. Then the next table, you can see the hospital details. It is there. Okay, like a hospital ID, which hospital, then the hospital from which city, which state, and what is the department. Then you can see here the third one is the doctor details. First one is the hospital detail, hospital with the patient readmission detail, then hospital detail, then doctor detail. Okay, the last one is the doctor detail. Doctor ID is there, doctor name is there, doctor specialization, and how many years of experience. Okay, then doctor availability. Okay, so such a details will be there. It's a very small data just for to show the analysis. I'm just created this data. Okay, so if you can see all these tables, the patient ID is the common column between all the three tables. Okay, so by using this patient ID, I have created the relationship. Okay, so then it could be the a single source of data for me. So I did the data modeling. Okay, when you can go to the Power BI, okay, you can see here this all the three tables, it is given the relationship. Can you see this? Okay, it have a relationship. So because of this relationship, I can take any data from any table, it will give the, it will give the report, or maybe I can create the visuals. So if you can see the first page, okay, I'm just checking. Okay, so I have the follow-up scheduled by 4 patients. Okay, so there is no 4 patients, no need for a follow-up, but a 6 patient they have to follow up. Okay, So this is the one. Then if you can see the bar chart, so readmitted by diagnosis. Okay, so like COPD should be 2, then diabetes 2, then heart failure 2, hypertension 1, like that. Then risk factor by age. Okay, so the very less age people like 30 years and all, they have a less risk factor, will be very low. But at the same time, age is more than, more than 50, you can see the risk factor, it should be very high, right? So this all are, it is coming from this kind of data. Then you can see here, each doctor how many patient they are taking care. The Dr. Steve, he have 3 patient, and Dr. Amy have 2 patient, Dr. John have 2 patient. Okay, so like that. So then if you can see patient by specialization. Okay, so what kind of specialization, according to the treatment, so they are, it given the specialization at this. Then you can see years by experience. Okay, so how many years of experience? Okay, 8-year experience have 1 patient, 10-year experience doctor have 1 patient, 12-year experience doctor have 2 patient, then 15-year experience doctor have 2 patient. Okay, so this all are help to the healthcare industry, what is happening inside the hospital, and how many patients are coming going, and which doctor is giving more attention. Okay, which doctor is selected by the patient more. So this kind of, insight the organization can understand. So this is the last one. So this hospital is actually from United States. So where the city these hospitals are there. Okay, you can see Texas, this hospital is there, California, so then Chicago, then yeah, New York, then Miami here. Okay, so then you can see here the list of hospital, and here the list of doctors. So each and the doctor where they are visiting the particular year or maybe the month. Okay, Dr. Amy, she is visiting for Green Valley Hospital, then Dr. Imli visiting into City Care Hospital. So all the details, it will be there. Okay, so this is a kind of live dashboard, so it will keep on update and changing. So the doctors and the management are in the organization, all this entire healthcare industry, they know very well what they have to do next. Okay, what is happening. Okay, so which doctor have to go to which hospital the particular doctor is available. So this is the simple data. You just imagine, if suppose 1000 doctors are there. Okay, some 10,000 hospitals, so who is visiting to which hospital, so which hospital have very rush and which hospital have very less rush. Okay, which hospital for the emergency situation they can immediately go and save the life. So this kind of very very important and essential things we can analyze by the healthcare analytics. So these all are very classic examples. So many things are there. Okay, it's unlimited. Okay, so you have to analyze, and you have to google it, how the healthcare industry is running based on this kind of data or maybe something else. So you have to keep your research. So now it's a time. Okay, so now it's a time you have to analyze and you have to understand the industry. So based on your understanding, maybe you can do some upskilling, or maybe if already you have some knowledge, yes, you can continue with the same knowledge, or maybe you can do some upskilling, you can do some certification, and you can learn some new things, or maybe you can select some mentors and you can ask them questions. So there are a lot, actually lot of opportunities. Yes, especially you students are very very lucky. Okay, so at the time, in our time, there is no artificial intelligence. Okay, there is no AI, so there is no chat GPT, so there is no any kind of automation. Okay, so this all are, we are slowly we developed ourselves, and we learned so many things. But I believe you have lot of opportunity, the particularly in this industry, and you can do everything. but only thing you have to maintain your time, and you have that learning in the interest, and these all things you have to take care, and you have to utilize your time very efficiently. Then only you can learn whatever things you are desired and interested. Okay, so you can also see here readmitted, how many hospital have readmitted patients are more, very less, this kind of thing. So here also, patient by department and hospital name, that kind of information. So this is just a one tool. It will help for the prepare the healthcare report. So there are n number of tools. So n number of tools are there. You can use even Python or maybe DAX. So many enhancing tools which will be helpful for more enhancing reports and dashboards. You can prepare it for this, especially for this healthcare analytics. Okay, so yeah, that's all from my side. Okay, thanks a lot for the great opportunity. Maybe I made it some mistakes, really burden me. And if you have any feedback, you please share to Alumni Association, or maybe you can tell me, or maybe you can take my mail ID. You can mail me. Yeah, thanks a lot. And yeah, you can ask the questions now.
Thank you, sir. It was a very good session. We were able to study more things. Thank you. So now I'd like to call upon Miss Jenny to give the vote of thanks.
Okay.
As we conclude today's insightful webinar, first and foremost, I would like to extend my heartfelt gratitude to our esteemed guest speaker, Mr. Manigandan Sinichami, for sharing his invaluable knowledge and expertise with us. Your insights have not only enlightened us, but have also sparked meaningful discussions. I'm also immensely grateful to all the participants for your enthusiastic engagement. Thank you.
Yeah, thank you. Shall we close? Yeah, thank you, and all the best.